I think a patient initially has to be well informed as to the type of facial aging that they're going through at their specific stage in life, so they can have a good idea and a reasonable idea of some of the procedures that may be recommended to them by a given surgeon. The patient should then do a good exploration to make sure that they have a skilled surgeon who can perform these procedures and has done so. And they have to make sure that they can communicate well and they have a good relationship with that surgeon. That ensures that the patient's able to accurately communicate their concerns that they might have about their specific facial aging, and they have a greater confidence that that surgeon really hears them and knows exactly what those concerns are. When that happens, there's a much more successful chance that the outcome is going to be ideal for both the patient and the surgeon, and the patient's going to feel that they have had all their issues addressed in a very, very accurate way. The next thing is that surgeons need to have significant skill to do these procedures, and experience is important. It's all well and good to perform these surgical procedures when everything goes exceptionally well and everything goes right. The patients love that and the surgeons love that, and we all wish that happened all the time. But it doesn't. It's still surgery, and there are still risks. Patients can have complications. So you have to make sure you feel that you're in confident hands with a surgeon that can handle things not only when they go well, but also when they don't. And there's a protocol in place to help you deal, you and the surgeon together, with those complications should they arise. The next things patients have to be aware of is they have to make sure that they're able to adequately articulate all of their concerns to their surgeon. They have to make sure that the surgeon never gets offended if the patient wants to seek an alternative consultation. Many people are exploring cosmetic surgery or just learning about it. They hear one surgeon describe a series of procedures that may be required, and sometimes they want a second opinion. This is information for the patient. It's only a good thing if they wish to do that, and it just adds more confidence for their desire to proceed ahead with a procedure in a confident way. The last thing to comment on is patients always have to be a little wary if if a surgeon is giving a patient a hard sell. It's important to remember that cosmetic surgery is patient-focused, and some patients are simply on a fact-finding mission trying to obtain information about these procedures. Some patients are ready for surgery, some patients may never be ready for surgery. So always make sure that you're prepared to go through a procedure when you're comfortable, not when somebody else wants you to go through it.